SureCheck USA provides automated low-cost compliance screening to healthcare facilities that provide Medicare or Medicaid billable services. Our company has grown by listening to our customers and providing additional products that fulfill their needs. Their careers in the association management business. The original association that was managed was the Illinois Association of Rehabilitation Facilities. IARF members serve individuals with developmental and behavioral disabilities in community programs and residential facilities. Funding for these agencies primarily comes from the state and from block grants. In 1997, Illinois passed a background check act, which would require all of these member facilities to conduct name-based pre-employment criminal background checks. This was an unfunded mandate, and these providers were already on a shoestring budget. As a result of this need, we created a criminal background check product and provided this service to the members of IARF at a deep discount from the current industry pricing. The new requirement affected many other industries, and our company was able to provide this service outside of the IARF membership to the other customers, but at a current market price. These checks include name-based criminal background check searches, OIG, driver's history, credit, SSN verification, and other services. To date, we have processed over 800,000 of these checks. A few years later, we added fingerprint services to our background check business. The story for the fingerprint business is similar and started with a grant to the U.S. Department of Education for our first piece of fingerprinting equipment. We now have over 65 locations in the state of Illinois and have processed over 500,000 fingerprint checks. We have built a company that provides several products and services based on customer need and market impact. SureCheck USA evolved from these two businesses as a customer need in the pre-employment screening space. As the federal regulations and guidelines for federal funding reimbursement for healthcare became more strict, many of the background and fingerprint clients requested OIG, Office of Inspector General, exclusion checks as an add-on to our services. We designed a software product that automates searches and as recommended by the OIG for healthcare facilities to be compliant with federal regulations and remain eligible for federal reimbursement funds. It is important to understand the responsibilities of the OIG and the impact that the regulations have on healthcare facilities. The Office of Inspector General's mission is to protect the integrity of Department of Health and Human Services programs, as well as the health and welfare program beneficiaries. Since its 1976 establishment, OIG has been at the forefront of the nation's efforts to fight waste, fraud, and abuse in Medicare, Medicaid, and more than 100 other HHS programs. HHS OIG is the largest Inspector General's office in the federal government, combating fraud, waste, and abuse, and to improving the efficiency of HHS programs. A majority of OIG's resources go toward the oversight of Medicare and Medicaid. OIG develops and distributes resources to assist the healthcare industry in its efforts to comply with the nation's fraud and abuse laws and to educate the public about fraudulent schemes so they can protect themselves and report suspicious activities. One of the OIG flagship resources is the exclusions list. There are specific reasons that individuals and businesses are on this list and severe consequences if a healthcare provider does not comply with this regulation. The OIG is required to exclude the individual or entity when an exclusion is committed. Causes for exclusions include, but are not limited to, Medicare or Medicaid fraud, patient abuse or neglect, felony convictions, theft, and financial misconduct, as well as losing a state license to practice, failing to repay student loans, conviction of certain misdemeanors, or failing to provide quality care. If an individual or entity is on this list and they provide any service to an entity providing healthcare services in any way, the result is that they're fined and or there are no federally funded reimbursement payments. In 2016, OIG developed task forces, increasing the number of people on staff to audit healthcare providers with the goal of decreasing fraud. As mentioned previously, a facility discovered to be non-compliant with the exclusion list regulation is required at a minimum to pay a penalty fee. The fines collected demonstrate the success of the task force's audit. These increased regulations and enforcement, the takedowns and fines are on the rise. in turn creating a demand for products and services that provide protection and ensure that nothing falls through the cracks. OIG now recommends that the federal and state databases be checked monthly. Minimum penalties for healthcare facilities who have excluded an individual on their payroll start at $10,000 and average $130,000 per instance. This fine also applies to vendors that they do service with and volunteers that come and work in their facility. So who should be checked and remain compliant with the OIG? All employers, physicians, vendors, and volunteers must be checked against the federal and state databases, which for most healthcare facilities means thousands of people per month. Many healthcare facilities either don't check these databases as advised by OIG, or they have members of their staff perform the queries each month. The task of manually checking each system is onerous and placing all of the risk on the healthcare facility if something is missed or if an employee neglects to check all data sources. How do healthcare facilities begin to implement a process to be sure they are checking everyone and remain compliant? SureCheck provides automated, low-cost compliance screening to healthcare facilities that provide Medicare or Medicaid billable services. SureCheck USA automates the monthly task of checking employees, vendors, contract workers, and volunteers against OIG Medicare Medicaid exclusion lists, including searches of the LEIE System of Award Management, Government Services Administration list of excluded parties, and all available state Medicaid exclusion lists. Using a system such as SureCheck USA frees up staff time, shifts liability from the facility to the vendor, and can provide preliminary data to HR within minutes of running the batch. Easy to use, secure, and accurate. It takes 3 steps for a healthcare facility to use our system. Prepare data in an Excel or CSV file to include name, address, city, state, SSN, or tax ID for businesses. Log in the secured portal and then upload the file. Our system is SSL encrypted web portal with access to results, reports, and invoices. Personally identifiable information and sensitive personal information are stored in an encrypted state in our database. Once the data is uploaded into our system, it automatically processes all uploaded data each month, reports all results to client, resolves any flagged individual business, and records all data needed for a potential OIG audit. This system provides healthcare facilities with an easy-to-use business tool that searches all available federal and state exclusion lists in one place. All reports are stored and can be accessed at any time by our clients. Healthcare facilities can hire staff to conduct these monthly tasks, but the burden of the time it takes to download, cross-reference, and resolve any flags is not only time-consuming, but also very vulnerable to human error and procrastination of completing the checks, creating a risk for audit failure and large fines, or possibly becoming ineligible to receive any federal reimbursement. So the question is, why risk? The ability to free up staff time who are currently working on performing these exclusions tests manually to work on other aspects of their jobs that they were actually hired to do. We will provide a peace of mind to the staff responsible for ensuring that the individuals who are employed are eligible and are not currently on any exclusions databases. We will provide peace of mind to the healthcare facility and their board of directors that due diligence was performed and that the patients are being served by employees, volunteers, and vendors who will not take advantage of them. Finally, through this monthly screening, we will help reduce the number of fines and penalties that the healthcare industry incurs through noncompliance. The next question is, products and services is our willingness and ability to customize the product for each individual user with no surcharges. Success in this business will depend greatly on customer service and flexibility. There are other companies providing similar products. However, we have learned from many of our potential customers that our product stands out because it is user-friendly, all-inclusive, and customizable. We have a great product. Our staff is terrific. Now, who do we sell to and how? Through Medicare or Medicaid. This includes hospitals, home health agencies, long-term care facilities, nursing homes, DD facilities, and more. To reach the decision maker, we will first focus on HR director and director of compliance at healthcare facilities, exhibiting at conferences directed toward these professionals, advertising in their industry-specific publications and on their websites, and presenting at their conferences and regional meetings will be our first approach to access the markets. Our broad marketing approach is direct face-to-face marketing, partnering with other healthcare compliance contractors, partnering with state and national associations in the healthcare industry to become a preferred provider, and offer non-dues revenue, education, web-based and print marketing. After industry research, we have determined that the Midwest Gateway is the best place to launch our sales. In addition to the close proximity to our central office in Springfield, Illinois, where our team can easily travel for any presentations and training. In St. Louis County alone, there are 42 hospitals and 168 home health agencies. This doesn't even factor in the long-term care and nursing home industry. The need and adoption of a service such as SureCheck USA in the St. Louis area by just 20% of the healthcare facilities would create jobs in IT, programming, sales, and support headquartered in St. Louis. According to the Bureau of Labor Statistics, there are over 170,000 healthcare workers employed in St. Louis, and we estimate that the number of volunteers and vendors that would need checked would equal or surpass that, just in St. Louis alone. That would be a potential of 350,000 entities that would need checked monthly. 20% of that market would be 800,000 checks annually. Many of those facilities are part of a larger system or network that we would gain access for marketing purposes and have more opportunities to grow nationally. In addition, 12% of healthcare workers in one state have been found working under another state's Medicaid program. With the central geographic location of St. Louis, this is a potential target area for people crossing state lines for employment and an increased need for facilities to actively maintain OIG exclusion checks. We have identified a problem, created a solution, determined an even better solution to combine background checks and OIG checks all in one. What more can we need? Contacts. As we begin generating revenue, we will have the ability to employ more people to perform the sales component, the resolutions component, and the continued programming components as we evolve with our customers' needs. Integrating our current background checks with our OIG exclusion software will provide a comprehensive business tool that will save time and keep healthcare facilities compliant and patients safe. Getting past administrative gatekeepers to present our product is time-consuming and difficult. Having resources that can open doors for our sales team to connect with the decision makers that are responsible for staff and compliance is invaluable to our sales success. We are confident that the ARCH grant will provide the funding needed to expand our team and the resources we need to contact the key decision makers at the healthcare facilities. In summary, we are the solution to OIG compliance regulations. The ability to free up staff time who are currently working on performing these exclusions tests manually to work on other aspects of their jobs that they were actually hired to do. We will provide a peace of mind to the staff responsible for ensuring that all individuals who are employed are eligible and are not currently on any exclusions databases. We will provide a peace of mind to the healthcare facility and their board of directors that due diligence was performed and that the patients are being served by employees, volunteers, and vendors who will not take advantage of them. Finally, through this monthly screening, we will help reduce the number of fines and penalties that the healthcare industry incurs through noncompliance. A partnership with the ARCH grant team will provide a complete package for entrepreneurs who have a vast knowledge of the healthcare industry and a track record of taking an idea to a robust, profitable business. Teamed with ARCH grants, we can expand our IT staff and improve our product by integrating our background checks with our compliance checks. The St. Louis area's many healthcare facilities offer the opportunity for sales in varied levels of the healthcare industry with the help and guidance of the ARCH grants team. Let's do this.